Hello, I'm Clovis Casali, and this is Talking Europe. Our guest today is the Foreign Minister of a country who's adopted a very different strategy to other European nations in tackling coronavirus. Sweden hasn't imposed a lockdown, and some have described it as a light touch approach. Ann Linde, thanks for joining us from Stockholm, I believe.
Thank you.
Is it fair to say that you rely very much on the discipline of Swedes to combat COVID-19, an approach relying on trust? You've chosen, for instance, to keep restaurants, bars and hairdressers open.
Yeah, I would say that in some cases that's right. But we have the same goals as most other governments in the world, namely keeping the disease low, to get the virus not to spread, to get the health system to be able to cope with the very big pressure on it, and to mitigate the influence on jobs and on business. And we do that in a mixture of legally binding measures and of recommendation. And that is because of our tradition. We have rather small ministries compared to France, but we have very big public authorities. And those public authorities comes with recommendation that the government follows many times. Most of the time, we decide in accordance with the expert advice from the public authorities. And the public knows that this is not kind of tip that you can choose to follow or not. It is something that you are expected to follow. And that is the way we think it's working in Sweden. And we can also see that people are following the strategy of social distancing, of washing their hands, and so on. Some cases, it's legally binding measure. We forbid to have any visits to elderly home very early on, for example. The recommendations are also to work home when it's possible, and we have made it possible to stay home for the slightest of symptoms by not requiring doctor certificate if you're sick, and don't have a qualification day for sick leave money to be paid out, as an example.
So the World Health Organization has said that the Swedish model might well be an example. At the same time, it does seem that you are seeking a collective immunity. That's a target, and or is it not? And your strategy is very clearly different from the strategy of France, China, or the US.
Well, we don't have a strategy of herd immunity. We know that that is a state that will come eventually, but it's not in our strategy. What is in our strategy is that we don't want to stop all transmission. We want to flatten the curve, and that we have managed with. And for example, there is still around 20% of the intensive care places that is free. And that means that even if it's very hard hit, the healthcare system has been able to put up with this enormous pressure. I would say, for example, when it comes to recommendation, we recommended people not to go to the most popular tourist destination in Sweden during Easter. And there was a 96% decrease in people going to those destinations.
Your strategy is clearly good for business, for the Swedish economy. Let's talk now about borders. How do you see the future? Are you keen to welcome tourists from other EU countries, or businessmen from other EU countries? Are you letting them in right now?
Yes, we're letting them in right now. What we have done is to follow the EU rules of not letting non-EU inhabitants coming into the country. We are following that. But when it comes to intra-EU, then our borders are not closed. But the same rules goes for people coming from other countries to Sweden as for Swedes. Keep the social distancing, behave in restaurants, and follow the recommendation as any other Swedes, but we have not closed our borders.
So it's not
when it
a
comes to
threat
tourism,
for you.
we
It's
have
not, it's not a threat for you to see people from other countries arriving possibly with the virus, people coming from more affected countries.
Well, the thing is that if we are going to get the virus not to spread, we need to have social distancing. We need people to wash their hands and all those recommendations. And that goes also for people from other countries coming to Sweden. Of course, they are expected to follow the recommendations. When you have restaurants, for example, if you're a tourist, it's not going on as usual. Many restaurants and hotels and bars has closed. And you can only have your restaurant open if you keep the distance. For example, if you have just every second table where somebody is sitting, and if you're not following it, you close the restaurant. Meaning that we so far has closed several restaurants because they have not followed the rules and recommendations. So that is the same rules. When it comes to tourism, we have a recommendation that non-necessary travels for all countries all over the globe should not be done until 15th of June. But we will take a new decision in the beginning of June if that is going to be prolonged or not. It's dependent on the situation. But so far till the 15th of June, no necessary travel to any country on the globe.
Okay, so many say also that there will be a before and an after COVID-19. How do you think this pandemic will change the way the world possibly works? Do you think we will have more controlled globalization?
Well, I am afraid of a too heavy deglobalization and a renationalization, because I don't think that would be good for the world. I think we need more international cooperation, not less. But there are some lessons to be learned after this crisis. And I'm very worried that the single market in the European Union are not working, and also that it was so relatively easy to make it not working. And that is something that we have to deal with afterwards. I also think that the way that China, US, Russia, and EU has dealt with it, with this pandemic, will have consequences afterwards when we evaluate it.
You were a Minister for Trade before becoming Foreign Minister. I'd like to ask you a question about trade, your expertise. Is it a concern for you, the situation, the current situation and the future situation, given that Sweden gets half of its GDP from exports?
Of course, it's a big concern. And I know that countries, for example, also in France, has now export restrictions. And I think in the single market, if it's going to be a single market for real, there could be no export restriction also in the time of a crisis. We need to rely on each other when it comes to medical wear, for example, when it comes to all medical equipment. And that has not been the case. And I'm very disappointed for that. And that is something that EU really has to deal with afterwards. Sweden has 70% of its export in the single market of EU. And in these cases has showed the vulnerability of the single market.
And let's talk about Europe now. How do you think Europe has handled this crisis? There's been a lot of debate, a lot of controversy. People in Spain, in Italy, some of the countries worst affected, saying there were no signs of solidarity. What did Sweden do? What is your point of view, notably regarding the corona bonds?
Well, when it comes to the corona bonds, it's actually that first of all, I would say that we think it's not good for EU to have a common putting themselves in debt, because we have to pay it sooner or later. And EU, the treaty of EU is actually forbidding the member state to guarantee each other's debt. And every country has to be responsible for their own finances. And if we have a common debt, that means that the national decision making in the economic policy will be taken aside, and that's not acceptable to us. But of course, we need to have common packages, for example, to mitigate the impact on businesses. And I think that can be done also by prioritizing inside the common EU budget to take some of the things that we have already said should go to different issues. And now after the pandemic, we have to have a new budget. We don't just have to put money on top of the budget, because that will put us all in a very, very difficult situation.
So how do you think
it's not good for...
So how do you think this crisis will actually reshape EU policies?
Well, I think there will be a much more cautious way when it comes to the new budget, the new MFF. And I also think that we need to see what do we need the money for. Then, of course, we have the situation where one of the biggest member states, United Kingdom, has decided to leave. And that will be a big hole in the budget. And then we have to see, we cannot go on as before when we don't have the membership fee from the United Kingdom, and we have to act accordingly.
Ann Linde, thank you very much. Very interesting talking to you. Well, that's the end of Talking Europe. Stay tuned to France 24.